Nimzingladab. I am a hepatologist with passion to educate the public, and here I am today talking about fatty liver, a very common finding, and in which a lot of patients become confused when they are found to have a fatty liver, is a prevalent community problem. What should happen? What does this mean? What treatments are available? What symptoms are there? And what kinds of problems that will arise if nothing is done? Well, these and more will follow as we go through this tutorial today. I'll take you through a few things that will help us understand this together, so we learn in detail as much as time allows, so that we're able to educate each other. Well, fatty liver is simply defined as a condition in which fat accumulates within the liver. Why would fat find itself there? Well, that is left for a lot of detailed discussions to explain. But the liver may or may not be inflamed when that happens. There are several causes of fatty liver, and among which are alcohol, hepatitis, as well as metabolic syndromes. Now, these are quite technical terms, but what you should know is that it is not only alcohol or hepatitis that can come with a fatty liver. The commonest cause of fatty liver disease is not alcohol, and in which case that is called non-alcoholic fatty liver disease. For short, it is described as nafld, N-A-F-L-D. The nafld leads to inflammation of the liver sometimes, and in which case it is called non-alcoholic steatohepatitis, that is NASH, as you would hear occasionally some people refer to. The cause of NASH is not known, but is reported to be high in persons who are overweight or obese, diabetes, and or those who have high cholesterol and or on certain medications. Well, not all medications cause this, and neither does each medication causing fat accumulation in the liver cause that in every person. The symptoms of NASH is often not symptomatic. Suspicion is often raised when a blood test called liver function test returns abnormal, and which triggers more investigations. Sometimes somebody goes for an abdominal ultrasound scan. For whatever reason, they are told they have fatty liver. In other words, this is an incidental finding often. But that doesn't mean it is innocent all the time. What happens when there is suspicion of NASH? More blood tests will be done, and the liver would be imaged. For example, if there was no imaging done at the beginning. And this imaging will involve a fibroscan or an ultrasound, a CT scan, or an MRI, as the case may be. A liver biopsy may be needed. Biopsy involves taking a small tissue with a very fine needle on the side of the liver and sent to the microbe into the lab for more detailed microscopic examinations. This is relevant only if the diagnosis remains unclear. Well, how do we treat NASH when found? Lose weight, but lose weight in a safe manner. The aim to lose weight should not be more than 1.6 kilograms per week. Control diabetes. Now I'll go back to that weight loss issue. If you lose weight more aggressively, it can come with its own metabolic problems. Hence, losing weight within a controlled manner will be key. If cholesterol is high, then treatment of that would be relevant. Any medications that could be contributing to NASH should be stopped, and your doctor may prescribe some antioxidants which can give you some response and help. If NASH is not treated, it could get worse over time. The liver could become scarred in what is known as cirrhosis, And cirrhosis could become decompensated, meaning that there would be symptoms of abdominal or leg swellings, jaundice, the eyes becoming yellow or changing, and itchiness of the skin, as well as memory issues. Ultimately, cancer of the liver can occur in a few patients, but this is in a setting when nothing has been done. Well, this is how much time could allow. I hope you've been able to understand a thing or two. Please do not forget to subscribe to support this work, as I intend to bring in more helpful information. And if you need some more supportive and helpful information regarding the liver, put it in the comments down below, and I'll be back with some information that will support your health. Thank you very much for your time.